Ever wondered what makes malaria one of the most deadly diseases that humanity has ever known? Today we delve into this life-threatening ailment that has plagued us for centuries. Malaria, a word derived from the Italian term malaria, meaning bad air, is a complex disease caused by the Plasmodium parasite. This parasite is transmitted to humans through the bites of infected female Anopheles mosquitoes. Once in the human body, these parasites multiply in the liver, infecting red blood cells, causing bouts of fever and other symptoms that can be fatal if left untreated. However, not all mosquito bites lead to malaria. Only the female Anopheles mosquitoes carrying the Plasmodium parasite can cause the disease. These mosquitoes typically bite between dusk and dawn, making these hours particularly hazardous for transmission. The symptoms of malaria can be sneaky, often mimicking those of a flu or a common cold. They usually start showing up 10 to 15 days after the mosquito bite. Fever, headache, and chills are the most common symptoms. In severe cases, it can cause yellow skin, seizures, coma, or even death. Diagnosing malaria can be a tricky process. It often involves a series of blood tests to detect the parasite's presence. Rapid diagnostic tests are also gaining ground, providing results in less than 30 minutes. However, microscopy remains the most reliable and widely used method. So, how do we fight malaria? Treatment primarily involves anti-malarial drugs. Artemisinin-based combination therapy is currently the most effective treatment against the most common and deadly type of malaria parasite, Plasmodium falciparum. However, it's important to remember that the type of drugs and the length of treatment depend on several factors, like the type of malaria, the severity of symptoms, and the patient's overall health conditions. Prevention is also a key strategy in combating malaria. This includes measures like using insecticide-treated nets, indoor residual spraying, and anti-malarial drugs for high-risk groups. To sum it up, malaria is a life-threatening disease caused by the Plasmodium parasite, transmitted through the bite of infected female Anopheles mosquitoes. Symptoms can often mimic those of a flu, and diagnosis requires blood tests. Treatment involves anti-malarial drugs, and prevention strategies like using treated nets and indoor spraying are crucial. Malaria has been a constant adversary, but with ongoing research and increased awareness, we continue to make strides in our fight against it. Armed with knowledge and persistence, we can hope to eventually erase this deadly disease from our world.